Okay, so you see a strange new rash on your baby, and your heart just sinks, right? You're immediately wondering, what is that? Is it serious? What am I supposed to do? Well, today, we're going to clear up all the mystery around one of the most common infant rashes, so you can feel confident and totally in control. Let's dive in. All right, first things first. Let's put a name to this thing. Figuring out exactly what we're looking at is the very first step to understanding what it is, what it isn't, and, most importantly, how to handle it.
So you're looking at your baby and you see this, maybe it's a bit greasy, kind of scaly, or maybe just some flakes on their scalp that look like dandruff. You're probably thinking, what in the world is going on here? We're about to get you a very clear answer.
Okay, so the fancy medical term for this is seborrheic dermatitis. It sounds super complicated, but honestly, it's just a really common kind of skin inflammation. The biggest clue is where it shows up. It tends to love the hair-bearing parts of the body.
But you've probably heard of it by its much friendlier nickname, cradle cap. Yep, when this exact condition shows up on a baby's scalp, that's what everyone calls it. It's the same thing, just in a very specific spot.
Okay, so we have a name for it, but how do you know for sure that's what you're dealing with? Let's break down the exact signs you should be looking for.
You're going to see things like red patches or some scaling. And here's a big clue. It often gets way redder when your baby is crying or gets a little hot. On the scalp, it might just start out looking like a bit of dandruff, but then it can turn into that classic yellow, greasy, crusty patch that we know as cradle cap.
Now this next part, this is a big one, and honestly a huge relief for most parents. Unlike eczema, seborrheic dermatitis usually does not itch. Your baby is typically pretty comfortable, not bothered by it at all. Eczema, on the other hand, is famous for being super itchy and really irritating for little ones. That's a massive difference.
So, where does this rash like to hang out? Well, it loves those hair-bearing areas, so the scalp and eyebrows are top spots. But you can also find it on the face, tucked into those cute neck folds, under the armpits, and yes, very often right in the nappy area. You know, there's this memorable little saying to help you understand how it can spread if you don't manage it. The idea is that the cradle cap and nappy rash may meet in the middle. It's a pretty vivid image, right? And a good reason to get on top of it early. Okay, let's talk about the timeline, because this is probably the most reassuring part of this whole thing. This condition follows a pretty predictable path. And the best news of all, it doesn't stick around forever. So a lot of cases will pop up in that very first month of life, and it's most common in the first 3 months. But here's the kicker, the most important part. It almost always clears up all by itself by the time your baby turns 1. It really is just a phase.
Knowing it goes away on its own is awesome, but you're probably thinking, great, but what do I do right now? So let's get practical. Let's talk about the simple, effective things you can do at home.
Before we dive into the nitty-gritty, there is one golden rule. If you remember nothing else, remember this. Keep the affected areas clean and dry. That is the foundation for everything else you're going to do. Okay, for that classic cradle cap on the scalp, it's a really simple 2-step process. First, you just want to soften up those scales by gently rubbing in a little bit of baby oil or even olive oil. Let it sit for a bit. Then, when it's bath time, you can gently wash away all those loosened scales. Now, if you're seeing it in the nappy area, your number one enemy is moisture. So, what do? Change nappies often, like as soon as you know they're wet. Keep the whole area super clean and dry. And honestly, a little bit of nappy-free time to let the skin breathe can work wonders. All right, here are a few more quick tips, some do's and don'ts to keep in mind. Try to avoid soap, as it can be really drying. Go easy on the baby powder, and definitely steer clear of those old-school plastic pants that trap moisture. For any mild spots on the body, a thin layer of a good old zinc cream is great for creating a protective barrier. Look, home care is usually all you need, but it's also super important to know when it's time to call for backup. So let's talk about when to pick up the phone and get your doctor involved. The rule of thumb is actually really simple. If you've been doing all the right things, you're keeping it clean and dry, you're doing the oil treatments, you're on top of nappy changes, and it's just not getting better, or maybe it seems to be getting worse, that's it. That's your cue to call the doctor. So what happens when you go to the doctor? What can they do that you can't? Well, they have a few more tools in their toolkit. They might suggest a special cream with ingredients like sulfur or salicylic acid that really help lift those scales. If things are a bit more stubborn, they might prescribe a stronger cream. Or they might just point you toward a really effective over-the-counter option you hadn't tried yet.
Okay, we have covered a ton of ground, so let's do a quick recap of the biggest takeaways just to lock it all in so you can feel totally confident.
All right, here are the key things to drill into your memory. Number 1, this is super common. You're not alone. Number 2, it doesn't usually itch. A happy baby is a great sign. Number 3, it goes away. It's almost always gone by their first birthday. Number 4, simple home care works. And finally, number 5, just keep an eye on it, especially in the nappy area, to make sure it doesn't get infected.
So, there you have it. You know the what, the when, and the how. And hopefully, you can stop looking at this as some scary, mysterious rash and see it for what it really is. A totally normal, totally manageable little bump in the road of parenting. You are doing a great job and you've totally got this.